Welcome back to Podiatry Marketing. I'm your host, Jim McDannald. I am not joined by Tyson Frankel this week. You've got me on a solo show. I'm sure Tyson is often about either in the US or recovering from a big trip to the States. So he'll be back next week. Today, we're going to jump into a really fun and exciting topic, and that is what can AI do for your podiatry practice right now? You know, these days, the amount of hype around ChatGPT, maybe it's Google's Gemini, it's just kind of everywhere, and that's great. Obviously, it can help you write better. It can help you do different things that different digital tools currently can't currently do. But what are those things that it can actually provide you in your practice? What are ways that you can implement it right now to be more efficient in your practice? So that's what we're going to jump in today. I'll kind of give you the top 5 of ways you can utilize AI in your podiatry practice right now. So first and foremost is it can enhance your communication with other healthcare providers. These ChatGPT or these LLM-based note writing apps. For example, a podiatrist treating a diabetic patient with a full cert can leverage AI to draft detailed referral notes quickly and accurately. So, these AI agents, maybe it's on your phone, or maybe you have a browser that allows you to record the conversation. It's going to use structured data from the electronic health record that you create by this encounter, and it's going to generate a clear and compliance-friendly referral letter summarizing the patient's treatment, the follow-up plan, and recommendations. Right, so instead of having to spend all the time, after you get out of the treatment room to not only write up the note, but then also to write up, a referral, a thank you or an update, a referral letter to one of your physicians that's sending patients your way. This stuff can be done in a much more automated but personalized fashion. I think sometimes people get, we've all had automated phone calls or automated messages left on our voicemail, and it's super annoying. But the difference with AI generated notes is that it's going to pull this relevant information from the chart note and make it very, you can kind of craft it however you want, but it's going to make a very relevant and helpful note for that referring physician. So there's good communication about what's happening with their patient and what the plans are moving forward. This streamlined communication minimizes, like I talked about, having to write manual notes or doing something that's kind of obviously templated and not very customized. Uh, you know, while you kind of maintain the compliance within your healthcare regulations. So that's super important, right? Additionally, AI can integrate kind of cost transparency required by different aspects of things, but at the very beginning, whether it be the kind of accuracy and the amount of information you can put into a note, but also, like I talked about, sending these referral letters to a physician that referred the patient can be huge. It's going to help them understand what's happening with their patient. It's going to keep those lines of communication open and hopefully, generate additional referrals in the future because the doctors are happy about the care you're providing to their patient, but also the way you're communicating in a very personalized, detailed manner that if you were just to, step out of your office or step out of the treatment room, try to do the EMR and then also do the note, it's going to take a really long time. But these different AI models can make it very, very easy to not only do your EMR and your health note, but also these referral letters back to those physicians. So that's number one. Number two, well, before we jump into number two, like I talked about, it's going to boost the profitability of your practice, right? So by reducing the time spent on clinical documentation, you can focus on seeing more patients and spend less time on administrative tasks. Ultimately, you're going to save time, increasing your revenue potential. It's also going to help build stronger referral relationships, like I talked about. You're going to get more of these referrals and more cases sent to you because the referring physicians are happy with the care you're providing and the way you're communicating it. There's different companies out there that do this for you. Obviously, one is the EMR called Populate. It's got kind of that AI recording agent in the background, something called Heidi, which is pretty popular these days, and also Nabla. These offer AI-powered clinical note generation. It's going to reduce that amount of manual documentation and helping improve the care coordination between you and that referring physician. So there's also Amazon Web Services. There's something called HealthScribe that might also be something to be integrated into your EMR. A lot more and more EMRs are having this be a part of the EMR. So definitely talk to your provider to see if that's something that they offer. And if not, what is the roadmap to having either something built into the product itself or having some additional software that integrates into your EMR to make these healthcare notes and all the treatment notes and also the referral letters super easy for you and for your staff. Next, we're talking about kind of streamlining patient communications, right? So, you know, for example, after an ingrown toenail procedure, AI-powered messaging systems can automatically send follow-up texts or email to patients about, what is the kind of the proper post-procedural treatment for that, right? Obviously, you can give them handouts as well, but that's totally okay. But sometimes daily reminders about, okay, today it's time to change the dressing, or you can't get it wet until this day, so continue to keep it dry. Sometimes either through a text message or an email is going to be much more relevant for that patient. Maybe it's something you send out at 7 a.m. every day to them so they know what to expect. If it's still a little bit painful, maybe they're taking a little bit of ibuprofen or aspirin. If they have bleeding issues, probably not aspirin, but just letting them know about what their options are in a way that is more customized, utilizing kind of AI assistant messaging. It can be a really, really helpful way based on, you can kind of tailor these communications based on the patient's history, the procedure provided. It's going to ensure that they understand the type of treatment that you are providing. This type of personal communication reduces confusion. Obviously that piece of paper you might have given it at a pre-op or at after the procedure, they may lose that in the car. They may not have it. Instead of them having to call back in the clinic and type your staff, if you let them know that you're going to be providing them daily updates as far as what they should be doing, either through their text message or through email, it can be a great way to allow them to kind of provide, it helps you kind of provide better care for them, even though they may not be in the clinic. So that's something to consider. Also, it's one of these things where, there's different ways of kind of reminding about payments. Obviously, we have those patients sometimes that, for whatever reason, they left their wallet or, they couldn't do the copay. Obviously, there's different payment policies you have in place, and those are up to you. But letting a patient beforehand know that they have a copay coming into the practice through an automated AI system can be a way to make sure that they're prepared and that you're actually receiving payment in a timely manner to make sure that you're minimizing that kind of miscommunication or upset patient that shows up and they didn't know they had a copay, and then you get a 1-star review. It can be not a great experience, not only for the clinic, but also for the patient. So if there's ways to improve communication through AI automation, that's definitely something to consider implementing into your practice. It's also going to cut down on, staff time chasing down payments, right? It's going to allow for smoother and more profitable practice. So, maybe it's, like I said, either a pre-payment or a post-payment. If this can be done in an automated fashion, it can be very, very helpful. There's a company called Cedar that currently collaborates with Google Cloud and has some AI-powered messaging solutions that really help simplify patient communication regarding billing and financial responsibilities. There's other ones out there, like Weave and other things that can be helpful. I don't know how much they've implemented AI as far as, checking with patients' insurance to make sure that they have that copay ready to go. But this is something to be aware of that is possible now. It's just whether it integrates into your EMR and scheduling system currently. Number 3 would be it's a great way to AI can be a great way to automate administrative tasks, especially when it comes to billing and coding. For example, you're a podiatrist treating a patient for heel pain. You're using custom orthotics, maybe some shockwave therapy. You can use AI software to automatically categorize and apply the correct billing codes, right? These type of diagnosis, it's going to be these types of codes. The AI can extract that data directly from the EHR and estimate the patient's liability, sometimes, after the treatment, but also sometimes, before they start the treatment. So it provides options. It might also provide options as far as different payment arrangements. Maybe you like to charge up front for your shockwave, or maybe it's on a case by case or a treatment by treatment basis. Having that kind of built into an automated system through AI will help reduce the likelihood of unpaid bills. Like I talked about, gives certainty for the patient so they know what they're getting themselves into. They don't feel surprised or shocked by the way that things are going. Also can provide some different flexibility as far as payment plans go. If there's outstanding balances, AI-powered accounts receivable, systems can automatically flag them, initiate follow-up actions, whether it be an email or text message. Hey, just want to let you know your bill is due in 7 days. Obviously, it can be a great way to make sure that you're continuing to collect off of the great care that you provide to patients. So one thing to consider there. This is going to boost your profitability. You're going to be by automating the billing and coding eliminates, costly errors. It's going to speed up claim submissions and hopefully reduce the administrative burden. Hopefully, instead of having to have staff on the phone trying to chase people down or utilizing a collections agency, AI can be kind of a way for you to get more kind of speed up the payment of those claims to make sure that you're not kind of burning more man hours, right? People can be utilizing tasks within the clinic that are helping improve the patient experience instead of having to track down all those payments and all those claim submissions. AI also can resolve, like I talked about, this results in more efficient cash flow and less reliance on these kind of third-party billing services. So it's a great way to kind of drive profitability in your practice. There's a company called AKASA. They offer AI-powered coding and revenue cycle solutions that automatically categorize billing codes and reduce administrative work. There's some different EMRs. I know Populate is doing a great job, for example, to really kind of help automate some of these billing and coding workflows to make it more smooth for you and your staff. So that's definitely something to consider moving forward. Like I talked about previously, Amazon Web Services or AWS. They have something called HealthScribe that also includes billing and coding functionality. Whether that applies to your EMR, it's something that you need to find some software that plugs in there. There's more of it built out every single day. The next thing that AI can really help you today with your practice is streamlining patient scheduling. AI-driven appointment management is a huge thing. AI can automate your patient scheduling. It can optimize patient slots. It can minimize your no-shows by sending timely reminders and managing cancellations in real time. So if you're going to see a patient on a Friday morning and then they cancel, maybe AI knows that you have a wait list. It can pull a name and a phone number from that wait list, so you're able to see a patient in that slot. You're not having to spend time with your scheduler or someone else having to do that. It's a way to really bring more patients in the door in a really cost-effective, time-efficient manner. So AI can also predict patient needs based on historical data, right? So maybe every new patient is 40 minutes or something or 30 minutes, but maybe that you can do with a heel pain patient is only 25. So based off a specific diagnosis, when calls in for makes an appointment for heel pain, the AI scheduler in your EMR knows that only usually takes you about 25 minutes. It can adjust that schedule. So maybe by the end of the day, you can schedule another patient or two, or maybe have more time to do something you want to do in the clinic that's not related to patient care. But there's ways that you can really utilize AI to kind of suggest it can also suggest optimal appointment durations, like I talked about, for different types, ensuring that your time is being used efficiently, because that's super, super important. Maybe you can use AI to automatically, like I talked about, kind of fill in those last second cancellations. You're going to notify patients on the waiting list. It's going to send patient reminders and allow patients to reschedule through an online system instead of having to tie up someone on the phone. Maybe their kid is sick, but by sending out these patient reminders, it's going to make your schedule more efficient to make sure that people aren't no-showing you. It's like I talked about as well. It's going to reduce the administrative workload on your staff so they can provide a great patient experience, and you're going to keep your clinic's schedule full. By optimizing and scheduling and reducing no-shows and filling in those gaps of the patient on the waiting list, AI-driven appointment management really increases the revenue and ensures your schedule remains fully booked. This automation reduces administrative costs and allows your staff to focus on more critical tasks like the patient experience, and really contributes overall to the profitability of your clinic. So it's really important that you have efficient scheduling systems, and the more that AI is worked into these systems, the more efficient you and your staff can be. I know the Epic, NextGen Healthcare, eClinicalWorks are all kind of experimenting with different options when it comes to patient recall or automatic rebooking. So, look at your EHR platform and see if they offer AI-powered appointment scheduling features. Like I talked about, it's really going to help reduce no-shows and the administrative workload on your staff. Last but not least is personalizing healthcare. I think sometimes, when people think of AI or automation, they think, oh, that's not going to be very personal, right? Like it's going to be robots and those kind of things. But there's a lot of kind of grunt work or busy work we do. There's things that we see or things we type in a repeated manner. And by having an AI agent or some AI assisted software, to help with patient care. And obviously, whenever you use AI, we're going to double check and triple check to make sure that it's the output is what we put into it, because obviously these systems are new and we need to make sure the quality is high. But for example, you're treating a patient with chronic Achilles tendonitis. You can use AI to analyze not only the patient's complete medical history, their lifestyle, their insurance coverage, but also what are the ways that within the medical literature are people getting the best treatment for these types of diagnoses. It really helps you recommend a tailored treatment plan that's much more personalized than it had been previously. The AI can help you, take into account the patient's demographics, their past responses to different types of treatment. Maybe you did a steroid injection or you did some type of physical therapy that wasn't really beneficial for the Achilles tendonitis. It can help you determine some other ideal opportunities for getting that patient to feel better. When you have that information at your fingertips, it can authorize that custom plan that maybe it includes, physical therapy or regenerative medicine. Maybe the patient needs orthotics. It can also provide, transparent cost estimates for patients, right? They can get a general sense of what does it cost to treat plantar fasciitis during a normal course. So people have there's a little bit more financial transparency. I think, as, people are getting somewhat fed up with insurances and high deductibles, things like direct care and fee-for-service care is something that patients are getting more and more interested in. And if you can be transparent about your pricing, it really gives an opportunity to kind of be straightforward with patients about this is the average cost for someone that you treat for plantar fasciitis. At this point in time, it's something that can be a benefit to your patients, but it's something that in the future maybe payers will be asking you to do as well. So something that you can kind of take the bull by the horns and kind of get ahead of the curve by kind of providing this financial transparency for patients, that they'll be really, really happy that you do so. This is going to boost not only patient satisfaction, but also potential profitability of your practice. So, personalized treatment recommendations improve patient outcomes. The more data you can pull from, the more, the kind of in the scientific literature, what's working and what's not working. You can increase the satisfaction of patients that come to your practice. And when you have happy patients, they're more than happy to talk to other people about it. So it can be a real practice booster in a way as they kind of spread that positive, good word of mouth about your clinic. So it's going to increase the likelihood of people to follow up. And also, like I talked about, it can lead to additional referrals. By integrating cost estimates with your treatment plans, AI reduces kind of payment friction and improves cash flow by ensuring patients are informed and prepared to pay. Someone knows that, your plantar fasciitis course of treatment is somewhere around $1,200, or I don't know what it's going to be. That's just an estimate, but they'd be much more likely to understand, what that relationship is and what they should expect. It's not always going to be that way. Obviously, costs can change and no two patients are exactly the same, but some estimation and transparency can be helpful for patients. Furthermore, automated compliance with, cost transparency regulations. You want to make sure that, you're mitigating the risk of legal complications. You want to make sure you're practicing the standard of care. And by having an AI agent that's helping you, stay on top of the latest and greatest as far as what's really helping patients improve, can be a great supplement to the great care that you provide. So there's companies like Amazon Web Services and Google Cloud that are providing, kind of analyze patient data and help generate personalized treatment recommendations. Like I talked about, there's kind of new AI companies that incorporate some of the scientific literature all the time. And as time goes on, there'll be more and more of this implemented into the way you provide care. I'll close by saying, by applying these AI powered solutions, podiatry practices can efficiently address rising administrative costs and streamline operations and improve patient satisfaction, all the while maintaining a profitable private practice without needing to sell to larger corporate entities. You can maintain your independence and practice the way you want to with the help of AI. It'll make you more efficient. Your staff, maybe either you reduce staff or they can really focus more on things like the patient experience, so people are satisfied when they come to your clinic and really willing to spread that word of mouth that's going to lead to referrals. These technologies, these AI technologies allow podiatrists to remain competitive in an evolving healthcare market. You're going to deliver better patient care, and you're going to run a more efficient and profitable clinic. So that's kind of my rundown as far as the top 5 ways that AI can really benefit your practice now. If you're using AI in your practice and you have ideas that you think would be beneficial for us to share, To our audience, don't hesitate to let us know. You can email me, jim@podiatrygrowth.com, or you can go to our website, podiatry.marketing. We have a form you can fill out there and send us some information about what you think is working when it comes to AI in your practice. And we'd really look forward to hearing from you. So until we talk again, Tyson will be back next week. Enjoy the rest of your week, and we'll see you then. Bye now.